Welcome back to the Island Doc. So far, we've heard about breast cancer, we've heard from our breast specialist, and answered some questions.
And now we want to give you some recommendations. If you're a lady after 40 years of age, then you need to have a mammogram done every year.
And that's simply just, an exam where you take the breast and it just compresses the breast and takes an image of it.
You also, some patients, the younger patients, or in addition to the mammogram, may also benefit from an ultrasound.
And, much of us have already had babies, and that's similar. It's just putting some gel. It might be a little bit cold, and just rubbing the gel onto, the area of the breast.
You also need to have regular breast exams, self-breast exams. One other thing that we need to point out is if you notice a lump or any type of lesion, please go to your healthcare provider. Let them do the relevant investigation for you.
Which would be what?
Well, if you're a lady over 40, then we'll have a mammogram done. And if you're under 40, then we can do an ultrasound.
What about biopsy?
Yes. Now, patients who present with a lump, they always should have a biopsy, because there are some instances where the ultrasound will say the lesion is benign, which means no cancer. The mammogram may also look benign, but unless you get a tissue diagnosis, you cannot
actual tissue sampling.
Right. You cannot walk away saying that, the patient does not have cancer. You need a biopsy. One other thing that I should mention is that, speaking about biopsies, there are different kinds of biopsies. There's a true cut biopsy where you take a needle and push it and take a piece of the tissue, and an excisional biopsy, which means you go in and take out the entire lump. I know a lot of women in Trinidad go and they go see doctors, and the doctors go in and then they do an excisional lump and they take out the entire lump. Well, I have to argue against this practice. This is not good practice, because sometimes when you go in and you take out the entire lump, it turns out that it is cancer, and you have done the patient an injustice, because by doing an excisional biopsy, you have robbed the patient of a certain type of procedure called a sentinel node biopsy. This is for the doctors out there. Do not go in and take out the excisional biopsy, because you will predispose your patient to having lymphedema. So do not do the excisional biopsy. You need to do the true cut biopsy. So our
apple a day for today is that you definitely need to go get a breast exam done if you're over the age of 40, and have a mammogram done as well. And if you're at home and you're under the age of 40, please continue to do your breast self-exams. If you feel any lump, go straight in to your doctor. And don't forget, if you have any questions, feel free to send a message to theislanddocs@gmail.com or like us on our Facebook page at The Island Docs. Thank you guys again for viewing. See you next time.